Good morning, everyone. On behalf of SQFI, welcome to day 2 of SQF Unites. My name is Ashley Eisenbeiser, and I am Senior Director of Food and Product Safety Programs at FMI, the Food Industry Association. I will be serving as the moderator for this morning's breakout session, Food Safety Insights 2022, A Peek into the Crystal Ball. I'd like to welcome our speaker, Sean Stevens, who will explore some of the biggest regulatory and food safety issues facing the industry. I'd like to direct you to the conference website where you can access Mr. Stevens' full bio and connect with him through the messaging feature. If you have any questions during the presentation, please feel free to put them in the comment box and make sure you use the red question mark so we know that it's a question. After the session, be sure to click on the Breakouts tab on the right for the post-session chat where you can meet others and share your perspectives on the session. So with that, without any further ado, I will turn it over to you, Sean.
Thanks so much, Ashley. Thanks so much for having me today. Very excited to talk about a really important, well, I guess a series of important issues, right, that are affecting all of us in the industry. And it doesn't matter what segment of the industry we're in, whether it is we're manufacturers, whether we're distributors, whether we're processors, or retailers, right? It is a ever-changing time, and things are evolving very quickly from a food safety standpoint. I kind of say we're in the food safety revolution, and we've been in the food safety revolution really for the last 2 decades. And I think, the pace of this revolution is not slowing, it's speeding up. And it's actually, it's increasing in size when we think about the number of changes that we've witnessed over the last 2 decades, from outbreaks that have made the headlines to the government response, to industry's response. And we see sort of a balloon effect of new rules, new regulations, new initiatives, new current thinking, new industry best practices. And it's really great to kind of be on the cutting edge. Well, we're always on the cutting edge every day of these types of issues. So very excited to talk about the crystal ball. When we look to 2022, oh my goodness, I can't believe we're actually talking about 2022. It wasn't that long ago. We couldn't wait for 2021 to get here. And now we can't wait for 2021 to be over, right? In a lot of cases, 2022, and it's just around the corner. It's coming fast. I can't believe it's October, the end of October already, almost near daylight savings time. And we're going to be entering a new year. And we ask ourselves what to expect when we get into that new year. What should we expect? What is on the horizon? Right now I'm speaking from Amelia Island at the United Egg Producers Conference. We're doing a mock trial later today. And my role will be, for the audience, to keep Miss Lisa Emerald, the Vice President of Quality Assurance for a food company, out of prison, because in this mock trial, DOJ is bringing charges because she failed to prevent a knowing outbreak that she didn't know about. And those are real issues. These are issues that could potentially impact all of us if we work as food safety professionals. So the times are changing, the risks are new. And we're faced with not only everything we learned about in our food science classes, right, but other risks as well, whether it's regulatory or legal. So let's take a look. The crystal ball, as we sort of peek into the future, what's on the horizon. We want to talk about a bunch of things today. Recall trends. What are we seeing? What's driving recalls? We're going to use a little bit of predictive analysis to try to kind of see where we're going and where are our biggest risk areas and what should we be worried about most. We're going to take a look at some policy observations, some observations of what FDA is currently doing and what USDA is doing. The future of food safety, not only the regulations are going to change, but everything. The science is going to change, the rules are going to change, the industry is going to change, the business is going to change. We'll talk a little bit about that. Changing the way we speak, which is near and dear to me. Very important for us to, as we continue to grow and we ride this wave of the food safety revolution, not only change the way that we do business, but change the way we think. We have to challenge ourselves. And we'll talk a little bit about some what I would characterize as bad recall days. Now, one of the ways to predict the future, of course, is to look to the past, right? We learned a lot in past years, whether it was growing up, mistakes we made, or things that we've seen others do, or just history by itself. And I think it's incredibly important that we take a look in our rearview mirror every once in a while and say, yeah, okay, I remember that. And that's going to affect or influence my future behavior, or it's going to help me predict what types of things could happen in the future, right? And what steps I need to be taking today to ensure that I'm best protecting myself, my company, and my brand. So here we see, when we talk about trends, this is a graph I put together that shows total recalls from 2003 forward. This is class 1, class 2, and class 3 recalls. And we see how interesting the numbers have been over time, where in the early 2000s we were, a couple hundred was a typical recall year, spiking to nearly 1,000 in 2016. Now, this is just food products and pet food. This does not include food supplements or animal feed, right? So the numbers are actually going to be a little more drastic if we throw those other products in there. But we see sort of the trends, and we're going to kind of dive into the numbers a little bit and do some analysis. If I look at where we were last week, and the number may change slightly when I put this deck together, 379 recalls so far this year. That puts us on a trajectory for about 469 this year, total recalls, about half of what we saw in 2016. But the notable part here, and we'll talk about this some more as well, is that's indicating the number is going to go back up. And if we see, it's kind of like the stock market. What goes up usually comes down, and what comes down will typically go back up. And if we break it down even further, of the total numbers of recalls we've had about in the last 20 years, we've had about 4,500 class 1s, 3,000 class 2s, around 600 class 3s. And just like classless people, there are classless recalls. There's about 1,000 or so recalls that CSAN has not at least published publicly the classification. I would anticipate that the majority of those would likely be class 3s, putting us somewhere around 1,600 class 3 recalls. And if we overlay the numbers of FDA recalls on the total chart, we see that FDA is a huge influencer in the total numbers, right? Most of the recalls are for FDA regulated products. There's a lot more FDA regulated products in the market than USDA regulated products, so it makes sense. And one of the things we tried to do is we were compiling this data and putting this information together and doing this study was to scientifically predict, I would say, the mood of the agency, right? So one way to kind of know what the future holds is to get a temperature on kind of where FDA is at. Are they angry? Are they just sort of comfortably numb? Are they happy, right? And if we look at 2003, I think FDA was probably really happy. There was only a handful of recalls. 2004, the agency was maybe the mood wasn't as great because we saw a little increase. But then 2005 was a great year. Recalls dropped down. Everybody was static. We got to 2006 and whoa, it was great. But then weird things started to happen, right? We had these massive just fluctuations where the spikes up and then it spikes back down and the agency is happy, but then it's not so happy. And people are trying to figure out, what are we going to do about this, right? Recalls are in the news. The public is hearing about it. The Hill is hearing about it. Congress is hearing about it. And what do we do, right? Well, things that happen in the real world actually influence change. What was 2009? We saw a spike to 749 recalls from a very low number of 200 in 1 year because of PCA, right? One company, one ingredient just changed everything. And that, of course, and I will say, it's just an aside, it used to be in these types of talks, we always started with Jack in the Box, right? And Jack in the Box is like, thank God PCA came along, right? So now we're talking about PCA. PCA changed everything. It changed everything. And suddenly Congress congressmen and women started talking about changing, creating new laws and putting new rules in effect and giving FDA a new mandate to make the food supply safe. We saw in 2012, right, FSMA come online, and as 2011 signed into law, and as the agency began really paying attention to the new mandate it was given, we saw another spike in recalls. And of course, the agency wasn't very happy, right, with the numbers of recalls that we were seeing, and industry wasn't happy either, right? It's never good for any of us when there's large numbers of recalls. And with the drop in 2013, we climbed like a 757 leaving Atlanta up until 2016, where the agency was really upset. And I think we can attribute some of the larger numbers of recalls in 2016 to the onboarding of swabathons. 2013, 14, 15, agency got really good at going into facilities and collecting 100 or 120 or 150 samples and looking for the presence of Listeria or Salmonella, in essence, to test the effectiveness of the sanitation program in these facilities, which led to an increase in the total numbers of recalls being announced. And then, of course, in 2020, rolling into 2021 now, COVID was really the new focus, and we saw the numbers of recalls. I think in 2019, we would have actually jumped up with the number of recalls. And we did some analysis, and in January and February of 2020, we were actually on a trajectory to spike above 600. But about March, the numbers of recalls that were being announced dropped dramatically. And a big reason for that, of course, was our focus changed, right? From, my job is 100% food safety 100% of the time. And now my job is I have to create programs, right, to manage COVID. So we were all kind of looking in a different direction. And this year, recalls are a little bit lower, but they're set to increase above at least what they were last year. If we overlay on this chart, this scientific chart, the USDA or recalls of USDA regulated products, we see it's been relatively stagnant over the years. And relative is relative, I suppose. And the data, if tortured enough, would admit to anything. But we haven't seen the massive fluctuations that we've seen, at least on the FDA side. But the trends kind of match each other to a certain extent. 2015, the agency was maybe a little irked with 150 recalls of USDA regulated products. But if we take a look at 31 total last year, I mean that's almost unheard of. We in all of the data, we've never seen a year that's been that low. Congrats to industry, and to the extent our efforts led to those great results. But we're seeing, the USDA has typically been around for a long time, since 1906, and it's there's not a whole lot of fireworks coming out of the USDA side of things. So I call it the Stevens doctrine. Listen, if recalls go down, the agencies are happy, right? We're okay. It's not going to be a whole lot of push or initiatives for new regulations or new rules or new policy or new guidance because we're doing good. If recalls are steady, I would say the agencies are comfortably numb. When the recalls begin to go up and the outbreaks begin to go up, the agencies become very angry, right? And we begin to see new initiatives, right? People huddling around the conference room table saying, okay, we've got some trends here and we need to respond. We need to do something and respond. And that's when we see the new initiatives coming up. So to the extent we as an industry can do a better job driving those recall numbers down, right? There's less likelihood we're going to garner the attention of Congress or the administration or the leadership of the agencies in trying to devise new rules, right, to respond to issues that are existing in the marketplace. What's in store for 2022 as we look into this crystal ball? Well, I mentioned the stock market earlier. If we think of the S&P or NASDAQ, the recall chart looks just like stock market chart to me. And I'm going to throw out Sean's prediction for 2022 through 2025. You may disagree. I may be completely wrong. I might be off base, flying into a mountain. I don't know, but this is what I think will happen. In 2022, I foresee that the numbers of recalls. So we're on pace right now in 2021 to, I said, about 470. We're seeing a lot of recalls coming in now. Even on weekends, we're getting notices. So it seems like the pace is picking up. So I'm going to predict 480. 2022, Vegas would probably love this. It could actually be a new category of betting, I suppose. Instead of betting on the horse race, we bet on the number of recalls we're going to see next year. 2022, I predict somewhere around 560. 2023, probably somewhere in the ballpark of about 700, 699 I've got here. Might level off a little bit in 2024, and I think we're going to drive back up in 2025. That's just what I see coming based on 20 years of doing this. I hope I'm wrong. I hope the numbers actually get back down to where they were in the early 2000s. That's everybody's goal. But with all of the influencers in the market and the challenges that we face and the increased scrutiny, the increased surveillance, and, we're all doing a better job. So the better we do, the more mistakes we're going to catch, and we're going to respond to those. So here's where I think we're going. And especially when we think about, we've been operating in a world where, FDA doesn't come around anymore, right? Because we're trying to stay out of facilities, and USDA has been a little more kind of arm's length. That's going to change. And already we've got, today I've dealt with 2 separate clients who called and said, listen, FDA's in our facility, they want to swap. They're coming, and things are going to start to ramp up again, and mistakes that were made are going to be caught. So we have to be prepared for. We're kind of like, we do a lot of travel now. I wasn't traveling, and walking through the airport, I'm thinking, wow, this is just like it was before COVID hit. And just like air travel is normalizing, so too will be the presence of FDA in our facilities. So it's coming, and it's probably coming a little quicker than we either hoped or anticipated. Yeah. So it's, and the other part too, with COVID management, equalizing, agency visibility, and recalls will begin to increase. So we should expect those visits from FDA. We should expect more food safety assessments from USDA as these trends continue. All right. So what will FDA focus on, and what will drive recalls in 2022? What I wanted to do is just take a quick snapshot of the 2 most recent normal years, if we can say that, 2018 and 2019. And if we look at the total recalls in 2018, there's about 685 total, 124 million pounds of product that was recalled. But we only know the weights for 224 of the 684 total recalls. And if we multiply, if we kind of do the math, and we knew the weights of all of the recalls, we'd see almost 400 million pounds of product being recalled in 2018. That is an astonishing number. The 124 equates to about 5,000 school buses, or a whole bunch of cars. A couple thousand T-Rexes. That's a lot of food. And what were the major drivers in 2018? Undeclared allergens was number one. And I'm working with all segments of the industry. This continues to be one of our biggest challenges, is finding a way in a very complex supply chain where not everybody is paying attention all the time, finding a way to figure this out. Undeclared allergens, right? And I'd like to say we're doing a better job, but we're consistently, I think, falling short. Milk is always a leading allergen that's not being declared. Pathogens, interestingly, in 2018, salmonella, not Listeria, took the lead with 122, and then foreign materials, of course. And on the foreign material side, I guess the word of wisdom I would give is, with the amount of volumes that are now being requested by our customers, the production stressors, we're running our equipment as hard as it can be run. And we're not shutting down or doing preventive maintenance or taking the line off for a day or two, right, to replace components that have a shelf life in our equipment. And we're seeing increasing numbers of foreign material showing up in product because of equipment malfunction. So just a note there when it comes to foreign materials. There's certain things we can do today or tomorrow that might reduce those numbers. 2019, real quick, about 650 total recalls. The 96 million pounds we can account for, but that's only 100 out of the 600 recalls, right? So if we multiply that number by 6, we're looking at, almost 600 million pounds of food that were recalled in 2019 alone. It's 137 Sasquatches or Bigfoots. That's a lot of Bigfoots. And actually, if you think about it, if you multiply that number by 6, it's 800 and some thousand. That actually exceeds the human population of Wyoming. So a lot of food products that are being brought back off the shelves in 18 and 19. And as we begin to normalize, we're going to see, once again, undeclared allergens are right at the top of the list, neck and neck with pathogens in 2019. And once again, milk was the major driver. Milk. Pathogens, Listeria monocytogenes took the lead in 2019. And then foreign materials, of course, ranging from plastic, metal, glass, to blood. The one thing, it's unfortunate, but we never see like gold as a foreign material in a food being recalled. How great would that be? Gold and silver. 2020, we had a total of 420 recalls. Undeclared allergens once again took the lead with milk, pathogens, and foreign materials. So what's FDA going to be looking at when it comes into our facilities? It's going to be focusing on undeclared allergens. It's going to be looking at our ingredient statements. It's going to be looking at our formulations. Let's check, double check, and recheck and make sure that all of those are buttoned up. Consumer complaints as well, right? Will always sometimes give us an early warning. 2021, as of last week, we had 371 total recalls. We're on pace for about 460. 470 allergens once again in the lead with milk. Where did the Sasquatches go, right? Only 370 recalls. Whoa. But they're probably coming back. All right. So what's the new, recall paradigm? As we crunch the data and we look at everything that's happening, what we see here is large amounts of product being produced over long periods of time that's intermittently contaminated on the pathogen side. And that should be a warning sign to all of us. If we look at, all of the recalls for pathogens, well, let's just take a look. In 2021, there was 97 recalls so far for pathogens. Okay. 46 of those 97 involved multiple days, weeks, or months of production. So it's not cleanup to cleanup anymore, like it used to be when we went to school and we were sat in our food science classes. No. And if we look at, the recalls spanning days, weeks, and months, many of them involve some of the most sophisticated companies, right? Who have the most sophisticated food safety programs, who have the most resources to invest in testing and sampling, right? And we're constantly perplexed that we're being outwitted, outsmarted, and outmaneuvered by pathogens. And FDA has latched onto this. And that's why I think as FDA begins to move back out into food facilities and begins to conduct more and more inspections, this is what it's going to be focusing on, is swabathons and the effectiveness of sanitation programs, and whether or not a company is adequately controlling for pathogens. And remember, if FDA comes and swabs in our facility, which they will, and if they find Listeria, which in many cases they do, first thing that's going to happen is those strains are going to be subjected to whole genome sequencing. And the DNA signature is going to be compared against the genome tracker database to see if there's any human isolates, right, that match. And if they do, we're in a very, very uncomfortable position with the agency, because it's possible, or the agency could argue, that our food products were making one or more people sick. And if it doesn't match any illness in the database, we're branded for life, because if in the future, be it a week from now, a month from now, or 10 years from now, somebody does get sick, there's our isolate, right? Our DNA signature sitting in the database against which that could be compared, and the agency could come knocking. But this, to me, is an incredible stat. Now, how do we know all this? Well, sometimes we, as a lawyer, I every day actually get into conversations with my clients about, okay, we have an issue. There's something in the product. What do we do? Do we recall? Do we not recall? What's the precedent? If we do recall, is this a class 1? Is it a class 2 or a class 3? And I'm just going to take a moment to mention, the data that I've just shown you and the analysis that we've done. And the predictive analysis comes from our data set. We've worked over the last 6 years or so to compile information in our data set on every class 1, class 2, and class 3 recall that exists. And it's just go to, if you search for FIC recall report or recall report, it'll take you right to it. It's foodindustrycouncil.com/recalls. But it's a really great source for information. So if I wanted to know, like in half a second, how many recalls there have been for fingertips, I just type in fingertip, and boom, I see that since 2000, we've had 2 recalls for fingertips. One was cinnamon rolls, the other was potato scramble breakfast. And if I want to know what class they were, it tells me right there. One was a class 2 and the other was a class 3. I can also dig in and say, okay, how many recalls in 2021? And I see right here involving milk, right? There it is. Undeclared allergens, pathogens, foreign materials. This is a really great tool as well if you want to vet your suppliers, see if they've had any recalls in the past. This is a great tool if you want to conduct a risk assessment for your ingredients. How many recalls have there ever been for paprika, right? And for what? What were the hazards that were associated? So it's a super, super powerful tool. We love it. And we created it to help ourselves, and food safety is not competitive to give it away to the agency, but have some fun in here. We'll have some fun a little bit later in the presentation too, as we kind of look at some interesting recalls that happened in the past. So what's new and emerging? 3 strikes and you're out. FDA is coming back into our facilities. FDA is going to be conducting swabathons, and if they find Listeria, say for example, in our environment, and they find the particular strain, which they will, and the genetic signature, they're coming back, and they're typically going to come back in 6 to 9 months now. And when they come back, they're going to do another swabathon, and if they find the strain again, all right, 2 strikes. Then they're going to be back again in another 6 months. And if they find it for a third time, we are getting a warning letter. Warning letter is being sent downrange. It's coming at us, right? So 3 strikes and you're out. And what I will say is a word of warning. I believe the agency is moving to 2 strikes. So if we find Listeria in your facility on day 1, and we find the same strain of Listeria in your facility on day 365, you have, by definition, demonstrated that your sanitation program is incapable of eliminating a persistent strain, and we're going to be sending a warning letter. So that is, I think, on the horizon. It's coming, and is all the more reason why we as industry should be doubling our efforts in environmental control and sanitation. Too many recalls for a common issue can now lead to an FDA warning letter, right? So my company, unfortunately, I specialize in products that are, gluten-free, or they're dairy-free, or whatever the case may be, peanut, nut-free. And I'm not doing a good job. And I've got now 8 recalls over the last 3 years because of undeclared allergens. There's a good chance now I'm going to get a warning letter. And the FDA is sitting up tall, and it's looking and scanning for those companies that have demonstrated that repeatedly they have had issues. So let's look at our recall history, and if we've had a number for a same issue, we're on FDA's radar. We're a blip on the control tower screen, and we're going to get their attention. So make sure we're tightening those things up. Warning letters now being issued to retailers, actually for the issue I just noted. So if I'm a retailer and I have my own private branded products, I'm not making them, but I am contracting with co-packers who are. And those co-packers are, tripping over their feet every once in a while. And now I've got collectively 18 recalls for a, particular issue over the course of the last couple of years. FDA may be sending a warning letter across my deck and telling me that it's not happy and things need to change. So retailers, we used to FDA was hands off. FDA is spreading its jurisdictional wings, and it is now becoming more active in the retail environment. I predict, along with USDA, we're going to see more FDA activity associated with delis as we move forward. So this is, this stuff is close on the horizon. Cannabis and CBD. Wow. Just a quick note, I don't know if everybody likes it. A lot of people do CBD, and a lot of people like it in their edibles or in their food or oils. And the agency, it's about as illegal can be on the federal level, but the agency has kind of looked the other way and is exercising enforcement discretion for these products. And interestingly, there has not been a recall of CBD infused food products because of their containing CBD. You would think because it is technically illegal at the federal level that FDA may have hunted down some companies and forced recalls, but they haven't. They have sent warning letters when absurd claims are made, like this will cure cancer, CBD will prevent COVID. I don't know. But just, the existence of CBD in a food product has not led to recalls. There's only been 5 in the last 2 years. 2019, we saw some microbial contamination, yellow 6 in 2019 for a hemp extract. Some CBD oils had lead in 2020, and then a coffee. There was some temperature abuse, right? So it was a class 2 recall. That's it on the CBD side. So, gives some additional proof, of FDA's sort of taking a hands-off approach I think the market evolves, and, we collectively think about what's the best way to regulate these products because the consumer does want them. FDA is taking enforcement, Ms. Deneither, enforcement action against crazy claims. We can't, any product, just remember, we can't say, that our chocolate chip cookies will prevent COVID. So we always want to be careful. We do see on some of the immunity type drinks with turmeric and other types of ingredients, we do see some activity now with the plaintiff lawyers beginning to target those products, saying that what's being asserted is a health claim versus structure function. So, the agency isn't going wild on the sort of, we're stepping up to the edge, but we're not quite crossing it. They're okay. But the plaintiff lawyers may not be. Remote FDA audits have been and are continuing to be on the horizon, I think. And this is, a important point for those of us who are in higher risk categories. The agency is taking, all right, I got limited resources, right? I have only so many people, so many investigators, but I've got 1,000 facilities that I have to make sure I visit or at least have interaction with, right? Well, of the 1,000, 200 are high risk products. The other 800 are relatively low risk. So maybe we'll do remote audits, right? At least for now. We'll be able to document interaction with those low risk facilities. But then the high risk facilities, we're going to take all our investigators and our swab kits and we're going to send them there, right? Because that's, if you're going to go hunting, you go hunting where there may be game, right? They're going to go hunting where they may find Listeria. So that's, I think, is going to direct some of the agency initiatives. And we're going to see an increasing number, and maybe even increasing visibility and presence of FDA in those high-risk facilities than we've ever seen in the past. Increasing use of strain typing. Of course, FDA is coming in. They're doing swabathons. They're comparing those strains against the genome tracker database. When they get positives, industry. When I first started in this business, it was, we don't test. And unless we absolutely have to, right? I got my hands are behind my back and I'm being forced to we don't do it, right? Because we don't want to know. And we all know the more we test, the more we find. So we're just going to throttle back. It can't do that anymore, right? Because FDA is coming in, it's swabbing, it's testing our finished products at retail, it's testing our environments. We have no choice. So if we're going to test, well, that data better be useful to us. So I think it's super important, if you got a routine monitoring program, we're collecting 20 samples a week, 40 samples a week, 80, whatever the number is, and then we're getting positives. We got to do it. And usually with my clients, we'll do it under the attorney-client privilege, separate from the program. We'll send those off to a lab for strain typing, and and we might use ribotyping, or we might use other methods, but we put a uniform on that bad bug so that we know what is in our facility, and it helps us defeat it. I see it happening everywhere. I strongly recommend it. You cannot defeat an enemy that doesn't have a uniform. The more data we have, the better we can be, and the more successful we can be. Sesame Street, just a quick note, Sesame will become the big 8, the big 9, right? The 9th allergen. Welcome to the club, Sesame. And it's going to make our efforts at allergen control that much more challenging as we move forward. A new era of smarter food safety. I wanted to talk about sort of the practicality of what we're seeing with FDA on the ground. This is going to continue to evolve over the next 24 months. It's a real slow pace right now, at least what's visible, but the pace is going to increase substantially. But traceability is key. Outbreak response is key. FDA was commanded, make foodborne illness stop with FSMA. Make it stop, right? And now we see the written programs are in effect. Now we're going to see the policy and the other initiatives that are going to enable the agency to make that happen. Retail modernization, retailers were on the radar screen for FDA, and it's increasingly going to be so. The agency grows, it doesn't shrink. And then food safety culture, really big. And culture, I think, is going to be the driver, right? It's sort of the new food safety in the world, our new attitudes, our new everything. Everything is going to focus and turn on culture. And I'm going to say one thing about culture very quickly is we need to change the way we speak. We always talk about, and I see it in FDA's guidance, Listeria is everywhere. You should expect to find Listeria in the environment. If we're not finding it, our testing program isn't good enough. If it's in the drain, we can keep it in the drain. We can control it. We can't. If it's in the drain, it's going to get everywhere in the processing environment. It may already be there, and it's going to get on the food contact surfaces, and it's going to get in the product, and we're going to have large amounts of product being produced over long periods of time that are intermittently contaminated with Listeria, just like 46 of the 91 recalls this year for pathogens, right? So when we find Listeria, the alarm bells have to go off, the sirens have to go off, and we cannot train our CEO or our C-suite that Listeria is common or it's expected. Because if we do, when we ask for money to fix the things in our facility, they're going to deny it. What do you mean? You told me I'm supposed to find Listeria, right? If we're not finding it, our program doesn't work. All right, moving off. Bad recall days. It's fun just to search for the recalls that have happened. And I think, oh my God, it's right. Exactly. That's how we feel on a Friday afternoon, right before a holiday weekend, when we get a call from FDA or USDA that there's a problem. And we think to ourselves, oh my goodness, are you telling me this just happened? Hydraulic fluid in ground beef, 2005. I was actually involved in this recall. It was a super slippery situation. 2006, somehow a bird head ended up in a can of pinto beans. 2007, we had diesel fuel, not hydraulic fluid, but diesel fuel in seasoned turnips. 2015, we might have mentioned this a little bit earlier, a fingertip and potato scrambled breakfast. I'll bet everybody scrambled from the breakfast table when they found the fingertip. 2015, extraneous pieces of golf balls in hash browns. 2016, another fingertip in donuts and cinnamon rolls. 16, there was blood in taffy. It wasn't cherry flavored taffy. It was human blood flavored taffy. 2017, some more shredded golf balls and shredded hash browns. I hear they were packaging them in packs of 4. 2019, there was a bird foot. Somebody found a bird foot in a chocolate cake. Those are bad recall days. I'll just leave you with that image. And the most recent, this was fabulous, actually. This was great. Mini gummy butterflies. The product, so like mini gummy butterflies you buy for like your kids, right? But the product in the package actually contained Ollie sleep dietary supplements, which they won't cause drowsiness, they'll put you to sleep. I read about this recall. I went to the grocery store and bought more. And you know what? I get it. It's okay if you have a bad recall day and the kids are noisy and they just won't, be quiet. You can give them some of those, okay, and just put them to sleep. And then, if it's still, the kids are now sleeping, but it's late in the evening and your husband just won't leave you alone, maybe you give your husband some of those too. So bad recall days. Wrapping that up, when we have those moments, those difficult days or times where we have to make a decision, do we recall the gummy butterflies that will put our children to sleep? Yes or no? The question I think to always ask is, what would FDA think, right? And what would 12 jurors think? Or maybe more importantly, what would 12 jurors think? 12 consumers, 12 mothers, 12 fathers. What would 12 jurors think? Because if we ask the question through that lens and through that perspective, in almost every case, we will get to the right decision. And with that, I want to thank everybody for joining us today on this journey of what the future holds. I wish the news was brighter and more cheerful, but I think as industry and as industry professionals and as colleagues, if we continue doing what we've been doing over the last decade, working together, collaborating, networking, getting together in events like this, sharing our mistakes and sharing our best days, we will all become better, and the horizon in the future will be bright.
Thank you, Sean. That's some really, really great information. I think we might have time for just a couple questions, maybe one question. Does FDA do swabathons on routine inspections, or only if they have for cause to take samples?
Sorry, housekeeping is here. So the FDA will do inspections on a routine basis. They will do inspections on a routine basis on routine swabathons. So the expectation will be, if you're in a facility, if you're in a facility that manufactures vinegar, for instance, there really is no microbiological risk, so we're not going to see sampling. But if you're in a facility that manufactures a product that there is risk, the FDA will conduct a swabathon. I think back to a number of years ago, there was agency had inspected a facility that manufactured frozen dough balls, and the agency had swabbed in that facility. And you think, well, why would you could do a swabathon in a facility that makes dough balls that are intended to be put in the oven? The answer was because we wanted to. So in the two inspections that I heard about this morning from clients, FDA came in and they're routine, but they're swabbing. So the agency will most assuredly do it in most cases.
Right. Will FDA start swabbing in warehouses?
Not yet. I think there's a possibility if you have produce that's open or they want to test finished product, open the environment. Yes, it's a possibility. We do see the FDA coming into facilities that are processing produce, and they will swab adjoining warehousing areas as well as the processing area. If it's just strictly a warehouse and nothing else, and there's no processing going on, I don't think the agency would direct its resources to that, at least in the short term. But as the agency grows, who knows? 5 years from now, we may learn that aerosolized Listeria in the warehousing environment is a risk to produce that's exposed. They're in boxes that have, they're not completely sealed. So I'd say not yet, but stay tuned.
All right. Well, thank you. I think we're out of time, and apologize if we didn't get to your question, but just as a reminder, you can continue the discussion in the post-session chat by clicking on the breakout tabs and discuss this with your peers. And I'd like to say thank you, Sean, for your time. And
yeah, and I guess just as a follow-up, a note to think about if in the breakout, the question I would ask is, we should all really challenge ourselves. I kind of touched on it, but should we be finding Listeria in the environment, and how should we react when we do?
That's a great question. So with that, thank you, and I hope everyone has a great rest of your day.
Awesome. Thank you, Ashley. Thanks, everybody.